Good morning. It's wonderful to have you here. We're so very interested to hear your testimony. Please begin.
Thank you, Chairwoman McCollum and Ranking Member Joyce, for the opportunity to testify today. The Army Corps evaluated the state of health infrastructure in American Samoa's only hospital, the almost 60-year-old LBJ Tropical Medical Center, for DOI as directed by this committee last year. With the committee's permission, I'd like to submit a copy of the report into the record along with my written testimony.
Without any objections, Mr. Joyce. So ordered.
The report's findings are grim for America's most remote community of 60,000 Americans living nearly 7,000 miles away. Any cuts to this account would be catastrophic to the islands of American Samoa. American Samoa maintains one of the highest Army enlistment rates in the country and was first in recruitment twice in the past 5 years on a per capita basis, and has one of the highest veterans populations in the country. The VA spends $5 million per year on flights and hotels to treat these vets in Hawaii, often for care that could be done locally, but which is not available to them or their families. The Army Corps report states bleakly as follows, quote, "The current infrastructure of the LBJ Territorial Medical Center Hospital is in a state of failure due to age and environmental exposure. Extensive repair and/or replacement of the facility is required to ensure compliance with hospital accreditation standards and to ensure the life, health, and safety of staff, patients, and visitors. While the facility structure has held up relatively well, it is not in compliance with current seismic and wind requirements, and retrofits would be expensive and disruptive. The electrical and mechanical systems are in poor condition and in need of immediate repair. Architectural deficiencies have led to mold and mildew growth in critical areas, exposing staff and patients to significant health risks. Plumbing, water treatment, and medical gas systems are all in failed or failing condition. The facility is partly dependent upon funding from CMS, and further degradation of the infrastructure will result in non-compliance with standards and will result in denial of accreditation. LBJ is the only full-service healthcare facility in the territory, and further degradation of the plant infrastructure will hamper the delivery of care to American Samoa's population. Notwithstanding these poor conditions, our local government officials and hospital staff were able to successfully avert a major outbreak of measles that caused nearly 100 deaths in children in independent Samoa just 100 miles away last year. But no deaths occurred in American Samoa. The Army Corps reports modernization costs will range from over $100 million for minimum compliance improvements to over $500 million in total hospital replacement costs. We seek any increase the committee deems reasonable based on the Army Corps findings to this committee. With over 300 inches of rain and 2 tropical storms in the past year, it is a challenging environment for our hospital infrastructure. Modernizing the LBJ hospital with the basic emergency upgrades needed as set forth in the Army Corps report are essential. This increase will help provide the basic humanitarian health services which HHS CMS compliance requires. Considering the recent events with coronavirus and my home district's proximity to Asia, this is even more important now. I want to thank the committee members again for allowing me to testify, and I look forward to continuing working with you on this most important issue to the American Samoan people. Thank you.
Well, thank you. So part of our charge is funding insular affairs, and so we will look at the report and also look to see where there might be other funding revenues that could be helpful on this. So thank you for bringing the information, and that's so sad that so many children lost their lives to measles. So having good public health infrastructure that people can rely on is very important. To have that happen so close to your population must have really been disturbing, but because you have had some good public health, and we want to keep it that way with having a good hospital. So thank you so much for sharing. Could I ask, do you have any reports or concerns you could share with the committee about resiliency and climate change? We're also working on that in here in the future. That would be very helpful for me as we move forward. We need to make sure that you know, all of our territories, all of our brothers and sisters' voices are heard at the table when we work on these issues. So I thank you so much for coming forward. It was a pleasure having you here. I look forward to working with you and getting to know you better on these issues.
Thank you, Madam Chairwoman. We'll be sure to get that information
you.
to you.